Endometriosis is a condition where tissue similar to the lining of the uterus grows in other areas of the body. The female reproductive system consists of the vagina, the uterus, fallopian tubes, and ovaries. During a normal menstrual cycle, the ovaries make chemicals called hormones, which signal the lining of the uterus to thicken. The lining coats the endometrium built up to prepare to receive a fertilized egg. If the egg isn't fertilized, the uterus shades the lining. Through the vagina, this monthly bleeding is called menstrual period. If you have endometriosis, the lining type of tissue grows outside the uterus for reasons that are unclear. The misplaced tissue responds to the hormones just like it would if it were inside the uterus. The tissue continues to thicken, then shades and bleeds with every menstrual cycle. However, the blood and tissue that are shed outside the uterus have nowhere to leave the body. The trapped endometrial flow can irritate the surrounding area, causing inflammation and pain. Bands of scar tissue called adhesions may form, sticking one organ to another or causing the fallopian tubes to close. This can affect someone's fertility, which is the ability to become pregnant. Endometriosis can form endometriomas, also known as chocolate cysts. These cysts are fluid-filled sacs on the ovaries that can affect fertility. Endometriosis may also result in abnormal bleeding. The most common sites for endometriosis are the ovaries, the fallopian tubes, the outsides of the uterus, the supporting structures around the uterus, and the lining of the pelvic called the peritoneum. Other sites include the bladder, rectum, and intestine. The signs and symptoms of endometriosis are chronic, usually worsening central pelvic pain, pain before or during period, pain during sex felt deep within the pelvis, painful urination during period, painful bowel movements during period, abnormal bleeding, diarrhea, constipation or nausea, and difficulty getting pregnant called infertility. Your doctor may recommend treatment options from the following categories: pain management medications such as aspirin, acetaminophen, or non-steroidal anti-inflammatory drugs, also known as NSAIDs, provides relief from pain. Hormone therapy such as birth control pills can prevent monthly endometrial build-up and bleeding. A surgical intervention may also be needed to treat the tissue causing pain or bleeding. Examples of such procedure include removal or destruction of endometrial tissue, removal of adhesions and scar tissue, removal or drainage of cysts, removal or destruction of nerve fibers that transmit pain, removal of the uterus called a hysterectomy, or removal of the ovaries called an oophorectomy.